Welcome. Today we have Dr. Emily Pratt to talk about her career as a pediatrician. Before we start, let's do a little housekeeping. Make sure you check in. And as you know, you've been here a couple of career events already. So you know that we have to check in so that your teacher knows that you're here at this event. And if you have questions, there's a great document questions that you can reference to. And of course, the evaluation, this is how we track your attendance and give you credit. And make sure to always be on mute so that we don't distract the presenter. And if the QR codes doesn't work, we have the bit.ly link and put it on the chat. And also if the bit.ly link doesn't work, we have the actual link to go to our website and do the whole check-in and evaluation there. And the other thing that if you want a closed caption, just request it so that we can approve if you need the closed caption. And that is it for me.
Good morning, everybody. I'm Emily Pratt. I have some patients who go to Evergreen and some of the high schools around here, so maybe some people know my face, but if not, it's great to be seen for the first time. I actually did set up a little bit of a presentation that's a little bit more interactive at some points. So perhaps when I get to some slides, I'll ask you to take your unmute off for a moment and ask questions or have some ideas to share. But you can also use the chat box and I'll try to pay attention to that. So with that, I'll go ahead and get started. I'm going to share my screen. All right, so you guys should see my PowerPoint slide that says pediatrics. Is that what you see? Great. All right. So just a little bit about myself. My name is Emily Pratt. I have a MD, PhD, which is a combined degree. I have both a medical degree to practice medicine, and I have a PhD. I did a graduate degree program for science, for basic science, which I'm happy to talk about a little bit more, but mostly I'm talking about the medical degree today. My preferred pronouns are she and her, and I work at the Hillsborough Pediatric Clinic. I've been there for about 6 years. The Hillsborough Pediatric Clinic has been there for like 30 years, so it's really been a fun experience to be there and be part of the community. All right, so just to jump in, you know, I don't know if you guys has already had some physicians come talk to you, but a lot of people have questions about, like, how do you be a doctor? Like, how do you get there? And I have to tell you that I had those questions too, because I don't have anybody in my family who was a doctor. I'm actually the first person in my family to graduate from college, to go to college, and to graduate from college. The truth is, I have 2 brothers, and they had a hard time graduating from high school. So it was really a new pathway for me to just even think about becoming a doctor. So here's the pathway, one of many different pathways. The first, you got to graduate from high school. That is just step number 1. While you're in high school, you always do as well as you can. You know, you do not have to be an A student. It never hurts. It never hurts to have good grades. It never hurts to have an impressive transcript. But some of us mature a little bit later and realize what's important in life. So even if you had struggles in high school, you can turn it around later if you decide that you wanted to become a doctor. I actually know somebody who started medical school in their when they were 35. So you don't have to do this traditional pathway. So some things you can think about in high school are what you do outside of high school. So you got to, you know, got to do your classes. That's really needs to be the priority. But think about some extracurricular activities so that you can essentially make that next step into college, university with the best chances of wherever you want to go. So some traditional extracurriculars are things like clubs, debate clubs, really any like tech clubs, drama clubs, volunteer experiences is really amazing because you get to experience different sorts of walks of life that you may not have seen otherwise. Sports are really impressive. Anything that you're good at, really. And then thinking about like non-traditional curricular activities, adventures you've been on when you write your college applications. If you've been on a crazy adventure, like talk about that, because that's something that sets you apart. Hobbies you have, if you're really good at something, we're always looking for, physicians need to be meticulous, they need to be committed. And if you have a hobby that you are committed to and you're really excellent at, that sort of shows that you have those sort of qualities. Work, I had to work when I was in high school. I had a job. I didn't really participate in clubs. I did drama class, like drama club once in a while, but mostly I worked. So that was an important thing to tell people about on my resumes. And research, if you have an opportunity to do research in high school, like go for it. It's really fun. It's exciting. I think that's something that's a little bit more difficult for people to get into. It's hard to sometimes find opportunities, but and this last thing, reframing life challenges into life changers. Many of us have had really difficult experiences that are hard to maybe even talk about sometimes, but to realize that those difficult experiences form us, and you can reframe them. You can sort of see them from a different angle and say, you know, I overcame this, you know. Just thinking about people that I know personally, you know, I've had patients whose parents have been deported out of this country and have had to be away from their family, their parents, and they live with close relatives or friends instead. And that seems like that is such a huge challenge for that person, but it also has really made them stronger and more committed to their life pathway. So those things that maybe seem like, oh, this is like a terrible thing that happened to me, it actually might be something that, if you can reframe it and turn it into an experience that is a life-changing experience in a positive way, that's really a good thing to try to do. Okay, so high school, got to do it, finish it, keep it up. Then you get into college. So traditionally we do college for 4 years, you get a bachelor's degree. It took me 5 years to finish college. Sometimes it takes a little bit longer. Non-traditionally, people like the Oregon College Challenge Grant is so amazing. This is a program that you may know about that pays for community college if you have good grades, and it's a guaranteed tuition through any Oregon State Community College. That's an amazing pathway. You can do community college for 2 years and then transfer to a university. Like, what an opportunity to save some money, to get those early learning credits and then hit into university. And really anything other than college would be considered a non-traditional pathway. So some people go to work first. Some people are just kind of not really sure what they're going to do with their life, and they come back to it later. Like I said, the friend of mine who was 35 when they kind of figured out what they wanted to do. So after college, this is when you do your medical school, right? So a lot of people go from college right in, like pre-medical studies in college, right into medical school. Med school is typically 4 years long. So there's a couple different pathways in medical training to become a physician. You can do an MD program, which is what I have, but you can also do a DO. A DO is just a slightly unique pathway from traditional medical school we think about, and they incorporate more hands-on physical therapy type treatments for patients. The more I learn about DO college, the more I wish I had known more about it, because it just seems really amazing, the kinds of training that they get, and they can do everything that an MD can do. We have really parallel career paths. It's just a slight difference in the training that we get. Personally, I took 5 years in college, not just 4, and then I took a couple years off after college because I didn't know what I was going to do. I thought that I was going to go to do research. So I worked as a research technician for a couple of years after college, and then I changed my mind. I decided I want to do medical school. So that pathway from college to med school took a little bit longer for me. After medical school, so 4 years in medical school, I went to the University of Washington for college. I took 2 years off and I went to Chicago, and I lived in Chicago and worked at Northwestern University and the University of Chicago as a research technician. And then I came back to Oregon to complete medical school at Oregon Health Science University. I actually did a combined degree program of an MD and a PhD. So medical school, like I said, is usually 4 years long, but you can take this non-traditional pathway and do a combined degree. So if you're somebody who just really loves learning or you have a really particular career path in mind, you can do these combined degree programs. So like I did an MD PhD. So it took me 4 years for my medical school. It took me 6 years to finish my PhD. So I was in school for 10 years at OHSU. There are other combined degree programs out there. You can do a Master of Science, which is typically like 2 or 3 years. You can do a Master's of Business. So if you want to, your career path is to be CEO of a large healthcare chain or some sort of entrepreneurial aspect in healthcare, you might want to consider doing an MD combined degree with an MBA. You can get a JD. You can become a lawyer and a doctor all in one program. Those are really amazing. It's really impressive. You walk out of there, you're a doctor and a lawyer at the same time. And finally, an MPH, a Master's of Public Health. I think we all have become appreciative of what a public health specialist does in these last 2 years with the corona pandemic. People that you see on the news talking about the waves of COVID infections and predictions about what's happening with the future of coronavirus infections in the community, how we best protect ourselves and our neighbors and our families. Those people typically have a master's in public health. They are public health specialists. So you can have an MD plus an MPH, and that's can be a really powerful combination as well. All right, so now we've finished medical school for those 4 years plus. You are technically a doctor. You have earned your MD or your DO, but you're not done. You can't go out and practice medicine because just because you have learned some things, you don't know anything. You've learned some things, but you don't know anything yet. So you do some residency training. This is sort of like a on-the-job training. So residency is where you really commit to what kind of physician you're going to be. So for me, I did a pediatrics residency, but maybe you do a family practice medicine residency. Maybe you do radiology residency. Maybe you do a surgery general surgery or orthopedics or dermatology. There's all kinds of different kinds of pathways depending on what sort of physician you decide you want to be. And the residency training really is, like I said, it's on the job training. So you're working in the hospitals, you're working outpatient medicine in clinics. It is hard. It is really long hours. They call it residency because you live there. So you work sometimes over for 24 hours at a time, no sleeping, answering questions, taking care of families and patients. It is intense because there's a lot to learn. The shortest residency trainings out there, things like emergency medicine or pediatrics, are usually 3 years long. If you want to be a neurosurgeon, you're going to plan on being in residency for about 7 more years. So here we are. We've got 4 years of college, 4 years of medical school, now 3 or up to 7 years of residency training for those really intensive learning years. And then if you want to even more fully specialize, you can do some additional training and fellowship. So for instance, if you wanted to be an oncologist, if you wanted to be a cancer doctor, that's not a residency, that's a fellowship. So you do your training. Let's say you do your training in pediatrics. So you kind of understand general pediatrics, and then you go on and you say, I'm going to be an oncology doctor. So you do an oncology fellowship, and that might be 2 to 3 more years. The same goes for specialists in surgeries. If you want to be a hand doctor, you've done orthopedic residency, but then you go do a fellowship and just really fully understanding how to safely take care of injuries to the hand. Things can be extremely specialized. So that's sort of the general pathway for for becoming a physician. Okay, so ND asked me, what do you have to major in college? The college education can be extremely variable. A lot of people, like traditionally, they'll do a science degree, biology. There are some colleges that kind of have a, like technically like a pre-med pathway. Sciences are really important because med school is so science forward, as you might imagine. But I had people in my medical school class who were literature majors. They really, for med school, we want to have people who have a broad background and a thorough knowledge about all kinds of topics. I can tell you, for me, I actually started out as an art major in college, and then I switched to a math major, and then I ended up as a neurobiology major and a biochemistry major. So I sort of wound my way into the sciences. You have to have some science. You have to have some like basic science requirements to get into medical school. But you can really study whatever is your passion. Okay, so the next question, do you have to go into college right after high school, or can you jump into medical school instead? You cannot skip university. There is you can't get just right into medical school. Interestingly, there are a couple of universities in this country that have a fast path, if you will. So you can get accepted into their university at the same time that you get committed to be accepted into their medical school. So you kind of already know that you are like pre-accepted into medical school, but there's no skipping college. What colleges do you recommend for pursuing an education leading to this occupation? Honestly, whatever college is the best fit for you. You can go to, any university can lead into a physician pathway. You find the one that's the best fit for you, because you have to be successful at university. So you look for a place that you feel supported. You look for a place that just kind of feels like you. You look for a place that maybe you're the kind of personality that likes to be on a campus with 30,000 people. The University of Washington has like 35,000 students. So I sort of like that big city feel, but maybe somebody else wants to be in a little smaller, more intimate environment. So you think about some of the smaller state schools or smaller private schools. Honestly, like any medical school is going to be accepting from a big, wide swath of universities. It's just about finding the thing that you find enjoyable, that is a passion for you, and that you can shine, so that when you apply for medical school, they see that you're committed to it. Okay, so this next question, what's a typical day? I'm gonna skip that one because I have some more slides coming up. Do you have a degree for medical school, or is it possible to just do prerequisites? Do you have to have a degree? Yeah, you have to have a degree. What do you wish you knew but didn't when you first contemplated this career? I'm going to save that to the end also. And what's the route? What is the route you take if you're interested in pediatric surgery? So pediatric surgery has a couple different pathways, but so you do high school, you do college, you do medical school. Typically you do a residency in surgery. So you can do like a general surgery residency, and then you can do a fellowship in pediatric surgery. So surgery residencies are going to be like 4 to 5 years, and then a peds fellowship is going to be another 3 or 4 years. What are the 2 schools that you mentioned that have the faster pathway? I don't know off the top of my head. You can search, you can ask Dr. Google. Dr. Google will tell you where those fast pathways for medical school are. Are there any disadvantages to attending community college for 2 years and then transferring to a 4-year degree? I honestly feel like the advantages outweigh the disadvantages. If you work your way through your community college education and you transfer into a university, when you graduate with your 4-year university degree, it says the name of that university. So I see very little disadvantage to completing a community college degree and transferring into a 4-year degree. The only downsides perhaps are more social. You know, sometimes if you want to move out of state and do that right after high school, or if you want to move away from home and do that right after high school, you're probably not going to do that with a community college step. But I think it's an amazing opportunity to save yourself some money in the long run. Okay, I'm going to move on to the next slide, you guys. Those are all really good questions. Okay, here we go. So some of the scary things, hold on here. I can't see my slide. Let me move things around. Oops. Okay. So a lot of people go in thinking, oh, there's no way I could be a doctor. It's so hard. It's like, it costs so much money. It takes so much of your time. It's just, oh, there's blood. Like, I don't even know what it means to be a doctor. So those things are so true for a lot of us. Like I said, I didn't have anybody in my family who was in medical care. So it just like this unknown is a big deal. And there's things that you can do to sort of get around that. So for instance, I know a lot of you can do internships during your high school years. Try to hook up with a physician, try to hook up with somebody in a medical career so you can sort of get a little bit of a day-to-day of what that's like. But also like the unknown, if you can reframe that, just like I was saying, reframing things that are hard in your life, you can reframe how you look at that. And instead of being like scary, the unknown is scary, actually the unknown can be really exciting. You know, those feelings of butterflies in your stomach, those are the same feelings that you have when you're excited about something as when you're nervous about something. And if you can tell yourself like, wow, this is really exciting, you're going to be much more successful than if you just feel like, oh, this is so scary, I feel nervous about it. And that exciting, that unknown, it's often super rewarding in the end. You know, you've experienced new things, you have stories to tell that you had no idea about before. The cost, let me say a word about the cost, because that is a real that's a real thing. Medical school is expensive. So I would say this, I'm kind of spitballing here, you guys, but I would say it is not unusual to come out of medical school with $200,000 in debt of medical school debt. And university, sometimes that's what I mean. So getting a community college degree before you, free education, 2 free years of college, and then transferring into university. Maybe you did great in community college and you were able to earn some good scholarships so that you can offset some of the cost of your undergraduate education. So then when you go into medical school, there are some scholarships out there for medical school, but mostly it's not. There's a big range in like the cost of tuition for different medical schools, whether you're in state at a state university or you're going to a private medical school or someplace out of state or even internationally. The cost of medical school can be quite varied. So I would say, thinking about it on average, expecting to have a couple $100,000 in medical school debt, but although that sounds scary, that is very different than having debt from a credit card. That is again, we're going to reframe that. That is an investment in your future. Your lifetime learning potential for having a medical degree far outweighs any of the medical school debt that you might incur. You know, nobody ever said, oh, I feel so sorry that person, they're a doctor, oh, it's so hard for them. No, you guys, this is like, it is worth it. It is so worth it. You end up having like the security of a job that, you know, people are going to need us always. They need us throughout their life. So I really feel like that people are scared away by the cost of the education, but it shouldn't be scary. It's worth it. It's an investment in yourself and your future, and you are worth it. The time, yeah, it's a long time. I just told you, at the very minimum, you're going to do 4 years of college, you're going to do 4 years of medical school, you're going to do 3 years of residency. That's 11 years of your life. And you're like, oh my gosh, I want a job. That's all. I'm tired of high school. I'm tired of learning. I'm tired of being in school. I got to tell you right now that university is so different than high school. If you're not in love with high school, you know, whatever it is about the settings, and you know, when you get to college, it's a totally different experience. You're treated much more like an adult. You get to decide what kind of classes you take more fully. It's a different learning experience. And the same with medical school. You are with people who are all working hard in the same boat together. You're all headed towards the same goal of like completing medical school. It's just, those are years that we're all going to get older in 11 years. Whether you finish your medical education or you just did something else, we're all 11 years older in 11 years. So I also don't feel like that's a something that should hold somebody back. It is hard. Make no mistake. It is very challenging. Nobody can know everything about medicine, like ever. It is very hard. It's a hard job. It's an important job. It's hard, but it's so much more. Like all that hard work really pays off, and you feel like you're contributing to your community. You impact people's lives every single day. Literally saving lives. I mean, it's hard, but it's worth it. There's blood. That's true. Doesn't matter. You can go into specialties that people don't see blood. You could be a radiologist. That's a pretty great job. They never see blood. They read x-rays and CT scans and MRIs and imaging studies. You can be a pathologist. You're often not seeing the patient directly. You're taking care of their tissues and it's kind of removed. Anyhow, there are options. So if you feel a little queasy or squeaming around things, this can be overcome. You can overcome this. All right. Couple more questions here. Let's see. Are there more research opportunities when attending four-year university compared to a community college? Yes, there are. The people who are research scientists, they typically work at a university setting. So the answer to that is yes. Is the number of openings for a pediatrician increasing significantly in the coming years? I think the number of positions for a geriatrician is increasing significantly in the future years. Geriatrician take care of elderly people. Our population is aging, so we need more people who can take care of the elderly. We also need some of the specialists out there. So maybe the number of pediatricians might not be increasing significantly, but there are some specialists who really are at a shortage and we need more of them. How hard is it to get into medical school? What happens if you get rejected more than twice? I actually know somebody who had to go through 3 rounds of applications. That doesn't feel good. There's no way that feels good. But you know what? That person, they got in on their 3rd time and they showed over and over again how committed they were to this. And with every application and every time they went through the process, they learned a little bit more about what might have made them a stronger candidate. So this is not an easy pathway, you guys. You have to be committed. You have to say, I'm doing this, because there are going to be challenges that get in your way, whether it's not being accepted to your first choice of college or your first choice of medical school, or you have to go through the whole process again because you weren't accepted into medical school the first. There are challenges and you have to be committed. So this is just one more of those opportunities to reframe the experience and say, you know what, listen, I have applied to your place twice before. I'm still here. You're not getting rid of me. Just let me in. What are the skills or personal qualities you would say I would need for this career? I'm going to save that for the end. Okay. Okay, we're going to move on. So all right, so let's do a case together. So I made this up. This is not anybody in particular. It's kind of an amalgam of many people that I have seen and sort of thinking about. So I'd like you to help me through this case. So first of all, it's a 15-year-old boy presents to my office with 3 months of intermittent abdominal pain. So just sometimes he feels upset stomach. Sometimes he feels nauseated. So he feels like he wants to throw up. And it's just once in a while. And I said, like, why'd you come in today? This has been going on for a couple months. Like, what brings you in today? And his mom says, well, I brought him in because now he's missing school. He's missed 4 days of school because of this same symptoms. 2 weeks ago, he missed a day of school. Last week, he missed 2 days of school, Monday and Wednesday. And now this week, it's Wednesday. You're coming into the office on Wednesday, and he missed school on Monday and on Tuesday. So something's wrong. What's wrong with my son? Why is he having stomach pain and feeling nauseated? So my question to you guys, honestly, I don't mind if you take your mic off for a minute and tell me what other kind of questions would you like to know about this situation to figure out what's happening with this young man? So somebody says, what is he intolerant to? So like food, I think you mean like intolerant to food is what I think. Any previous history of medical issues? Good question. What else? So is he a healthy person generally? Does he take any medicines? That's such a good question. What medicines are you taking? How are you treating yourself? Do you take any medicines? I don't know what this means. I don't know what wouldn't you go through sample. I don't know what that means. I'm sorry. What's his diet? Good question. What's he eating? What's he not eating? Where is his stomach hurt? Perfect. Where's your pain? Is there a lot of stress from him at school? What's your family history? Has he been tested for food allergies? Awesome. Awesome. Good thoughts, you guys. These are all really good questions. Good. This is exactly the kind of thing you have to think about when somebody comes in, because a 15-year-old, fortunately, a 15-year-old can kind of tell me himself what he feels. I could ask him those questions, and if he doesn't have the answers, his mom might know the answers. But part of being a pediatrician is working with children who don't talk. You know, what if it was a 3-year-old who came in and they can't really explain to me what they're feeling? So sometimes I feel like being a pediatrician is kind of like being a veterinarian, because you sort of have to figure out what's going on with the puppy because they can't tell you themselves. All right, those are great questions. Next slide to answer some of those things. So here you go. Here's some of that's history. So he's mostly getting the stomach aches in the mornings. By lunch, he feels so much better. So he wakes up and he has a really bad stomach ache. He feels totally nauseated. Like, Mom, I can't go to school today. And then, so he stays home because he's feeling so terrible. And then by the lunchtime, he feels a lot better. And where is the pain? Somebody asked that. He basically points to the middle of his stomach, just to his belly button. And he says, but it really kind of hurts all over. So his kid is previously healthy. He has, you've known him for years because he comes in for his well checks and maybe for like cold symptoms, or he's been in a couple times, but really he's a healthy person. He doesn't really have any medical issues. He has all of his immunizations, including his COVID vaccination. So that's awesome. So we feel like he's probably not having COVID-19 right now because he's fully vaccinated for that. He has not been traveling. So part of that is like, did you pick up a weird bug from like a water supply someplace, or, you know, other parts of the world have different kinds of germs and viruses and bacteria, but he has no travel history. So it seems unlikely he has some sort of exotic to us disease is causing these symptoms. He has not been hurt. He's not a football player. Like, he didn't get, or a soccer player. He didn't get hit in the stomach. He hasn't been in a car accident and had his seatbelt on and like caused internal injuries. So I ask about pee and poo because that's your stomach. So we got to ask about that. So he says he goes to the bathroom. Sometimes it takes 2 days to go poo, and sometimes I have diarrhea. So it's just kind of like sort of hard to pin down like what his bowel habits are, but sort of sounds like maybe sometimes he has some constipation and it hurts to poo, but also sometimes he has really like loose bowel movements and that's going on. But there's never any blood in his poop, and he doesn't have any pee accidents. He doesn't have any poop accidents. And then what else is not happening? So he tells me that there has not been any fevers. He doesn't have a weird rash. So feverish would make you think about like something infectious. He doesn't have a rash. There are some infections that have rashes associated with abdominal pain and then rashes on your body. There are some autoimmune disorders that can have abdominal pain and rashes on your body. He doesn't have a sore throat. So sometimes if you have a sore throat and stomach ache, that can be a sign of things like strep throat. He's not having any headaches. So thinking about headaches, more systemic symptoms also. It's really just abdominal pain. He doesn't have any cough symptoms, so that sort of rules out what we think about as like respiratory illnesses as well. And no dysuria. Dysuria means it does not hurt him when he goes pee. So for anybody, your bladder is in your abdominal cavity, and sometimes we mistake like an upset stomach for bladder issues. So he's not having any pain when he pees. And family history, somebody asked about that. His dad has an autoimmune disorder called ulcerative colitis, which is an illness where your immune system attacks your own intestines and causes inflammation and bleeding inside of his intestines. So that's kind of interesting, right? Okay, let's go back to our chat box and see what else we have. Has he been drinking water? He's totally been drinking water. He's really good at hydrating. He misses breakfast on that day, those days when he feels really sick, but then the rest of the day he eats just fine. He's drinking water. Good question. Did he ingest a foreign body? That is a very good question. I would think about that more with like a younger kid, like a 2-year-old who comes in. I would ask, like, I would absolutely have to think about, did they swallow a coin? Did they swallow a battery? Like a button battery can be really dangerous. There are some foreign bodies that are life-threatening. You know, if you those really strong magnets that are in toys and things can be life-threatening. If you get 2 magnets that are swallowed and they are on different sides of your tissue inside your intestines, they're so strong they will continue to like try to connect with each other through the tissue and work their way through so that you end up with a little injury and like bleeding in the tissue, and that can be life-threatening. So it's a good question. Did he swallow a foreign body? The dad might have passed on ulcerative colitis to him. Absolutely. Yeah, that is there's a strong genetic predisposition for that. All right, signs, symptoms, allergies, medications, past medical history, all those things. So we kind of talked about a lot of those. He's been eating fine, drinking okay, and then events that led up to this. That's a very good question. What's the questions you would be asked? SAMPLE. I'm sorry, I don't know what that stands for, but oh, signs, symptoms. Now I know, you told me. I get it. Okay, that's your acronym. Signs, allergies, medications, past medical. Very good. Yeah, that's good. So there are so many different acronyms we think about. That's a good one. All right. All right, let's move on. Okay, so just thinking about like all the different things that could be going on, you have to think about like anatomy first, right? Like, so what's there? So first of all, like could this be abdominal wall muscle issues? Like there are bones in that area? Like there's, just where it is in the body, you have to have a good sense of anatomy for external anatomy as well as internal anatomy. Like inside the abdominal cavity, there's a lot going on right there, you guys. So you have all the intestines. This is obviously like the intestines where the poo happens. Up here is your liver, your gallbladder. Don't forget about that. Like, could he be having like a gallbladder issue where he has gallstones and that's causing abdominal pain? The stomach, could there be some inflammation in the stomach? Could he have like some reflux? Where acid from the stomach is going up into the esophagus, and that can cause nausea, that can cause upset stomach. You could have infection called H. pylori that causes ulcers. Could he have the ulcerative colitis like his dad has? There's the pancreas is in here. This is an organ that releases different hormones and helps to break down food. Could his pancreas be misbehaving? Could he have early onset of like diabetes symptoms, where your pancreas is not making insulin properly? And then if we take out all these big organs, what's behind them? This is kind of a picture that shows what's back behind all those initial organs. You've got your bladder down here, you've got your kidneys, back here is your spleen. This is an organ that helps with your immune function. Up here, this big muscle is called, this is your diaphragm, and your lungs are up here in your heart. Like sometimes if you have inflammation of your diaphragm, or you have weirdly enough, if you have some issue in your lungs, it can irritate your diaphragm and you can feel like it's abdominal pain. So you kind of have to think about all these different places when you're considering like what could be causing this kid's symptoms. And really, like, the differential diagnosis for abdominal pain is huge. There's so many things that could be going on. You don't even have to be able to like read all these. Just know these are all different conditions that you sort of need to have a sense of, so that you can dig down and figure out like what it is that's happening for this young man. So I feel like we have some good ideas already. So let's do our exam, because when you're in medicine, the history is so important. You got to get all kinds of, you have to understand the patient's experience so that you can sort of put yourself there and sort of try to be the Sherlock Holmes to figure out what's going on, or the William Osler is the equivalent of that in medical history here. So he has normal vitals. His blood pressure is fine. His pulse is fine. His heart rate is fine. He has a normal temperature. I didn't tell you this, but he has not been taking any medicine. They haven't done anything. So that was a good question. He does not take any medicine every day. He's just a healthy guy. He doesn't take any medications. You know that the last time you saw him 7 months ago for his like annual check, he's gained 15 pounds since then. But you think, gosh, well, we're in a pandemic and most of us have gained some weight because we weren't at school. We haven't been active. We've been home. But at the same time, he's gotten 3 inches taller. So this guy is going through puberty. So that 15-pound weight gain is actually totally appropriate. He's not losing weight. So that's really important to know, because there's a lot of things that can cause weight loss that you would be really worried about if you have abdominal pain and weight loss. That kind of raises my suspicion for other scary things. But he's gained an appropriate amount of weight and he's gotten taller. So this is all pretty normal. And our physical exam, there's nothing on exam that seems out of the ordinary. So let's see, we've got one more little chat here. Yeah, so this, Tristan, those ideas about pH levels and mucus in the stomach, that sort of gets at the gastric ulcers or reflux. Those are really good ideas. Okay, so we're doing the exam and then I ask his mom to step out because he's 15. There's a lot, sometimes mom has been in the room the whole time, and there's a lot of times where people just feel uncomfortable saying something in front of their mom. So I really, if I just don't know what's going on, I will ask the family to step out so I can have some privacy. And I remind people that we have confidentiality laws in Oregon, where you have a right legally to confidentiality between you and your doctor, so that information stays between you and your doctor. So if you feel like there's something that you can't tell your parents and you're there at the doctor's office, like, they don't have to know about it. It's always best if your family is involved in your care and they kind of know what's going on with you. So that's something that we want to encourage. But there are situations where that's just not safe, or it just doesn't feel safe. So in Oregon, you have a right to confidentiality between you and your doctor. So this young man, he's never had sex, which is normal. The vast majority of people have not had sex by the time they graduate from high school. Don't let anybody else tell you that. That is a fact. More than half of people have not had sex by the time they get through high school. Do not feel pressured. Take your time. He feels safe at home. You ask him, like, so what's going on at home? Like, is anybody hurting you? He feels safe at home. And he doesn't do any drugs. He's not self-medicating with drugs. He doesn't smoke cigarettes or marijuana. He's not vaping. So then I ask him about school. I was like, well, what's going on at school? And he just kind of pauses and doesn't really say much. But it turns out that, so you kind of, you go there. That's a sign something's happening. So you go there, you ask him some more about it. It turns out he's really a pretty good student. But this year, returning to school in person has been very challenging. He's been out of classes for a year and a half. His family, he had an uncle who passed away from coronavirus. The uncle lived in another country, but he knows somebody who passed away from coronavirus. Returning to school has been really hard for him. Like in-person learning has caused him, like he just he's feeling worried that he's not doing well enough. He, for some reason, like when he's around big crowds of people, he feels like his chest hurts a little bit. He feels a little dizzy. He's kind of feels overwhelmed. And sometimes at night he thinks about like what he was doing that day before, and it's hard for him to sleep at night. He's just kind of thinking about like, oh, did I embarrass myself? Like, what was going on? Why did I do that? Or so he's definitely has some anxiety. He's got some worries about that is new for him. He's not an anxious person typically, but returning to school has been really challenging for him. Social anxiety. He has some social anxiety. He absolutely does. And this is a new feeling for this young man. So anxiety. This is the absent pandemic. I made this up myself. I've called it the absent pandemic because people are missing school so much because they're feeling anxious. There's an increase in absences due to anxiety since people have returned to class. And this is a diagram that talks about like anxiety as a reinforcing cycle. So what happens is he wakes up in the morning, he feels fine, but he wakes up and he's thinking about school and he's like getting ready for school. And he's just like, oh, he's starting to like, just, it's coming out as like his stomach feels really hard and he's feeling nauseated. He's just like feeling so sick. And he's like, Mom, I can't go to school today. I just feel so sick. So she says, oh, honey, I can tell. You stay home. I'm worried about you. So she lets him stay home. And then, oh, thank goodness, I feel so much better. So he's here at lunchtime and now he's feeling better and everything's fine. But then the next day he wakes up and here it's the same thing. I got to go to school again. So he starts to feel sick in the morning. And the problem, that same cycle works its way through again. And the problem with this is that if you're not going to face that thing that's causing you anxiety, if you're not heading it, seeing it head on, every time you go through the cycle, your anxiety, it gets worse and worse. So that's what's going on with him. So he was having a little bit of anxiety, but now he's missing a couple days in a row because his anxiety is just like rising and rising every time he misses school. He feels better, but then it just gets worse because it's built up to be even a scarier thing than it was before. So social anxiety. He's having stomach aches because of social anxiety. Yeah. So we make a plan. So we don't jump into medications. I'm not like, here, take some anti-anxiety medicines. That's not what we do. We talk about how to help ourselves as a first step. So I offer a referral to a counselor. I offer a referral to behavioral health services. The truth is right now, those specialists are a bit overwhelmed. So it can take weeks to months to see them. So at the same time, I give them some resources for some self-directed learning. You guys should take a screenshot of this because these are really good websites that have some excellent information, especially like this Child Mind Institute. So it's in English and Spanish, so good. This anxietycanada.com. What I love about this is they have a tool so that you can create your own anxiety plan. It helps you figure out like, what are your triggers, and gives you some ideas for how to manage your anxiety in the moment and ahead of time. And you plan it before you're feeling anxious. So you already know what to do. As soon as you feel that nausea, as soon as you feel that stomach ache coming on, you have a list of like 1, 2, 3. These are the things I need to do before I move on, so that you can face that thing that's causing anxiety for you. There are some wonderful apps out there that are free, as well as you can pay lots of money for things, but these are 2 that are free. This Smiling Mind app is awesome. It's out of Australia. and it's free, and I like it because they have an Australian voice, which I find very soothing, but it's kind of like some directed meditations, and this Dailyo app is also great because it helps you sort of track your feelings and what you have experienced during the day, so you can sort of relate. You could look back at several weeks of activity and feelings and sort of figure out some patterns that you've made for yourself. So this is just a few of many different things out there that can help with anxiety. And then we talk about how that versus that last curve that talks, if you are avoiding things, your anxiety is going to get worse. This is what happens when you face your anxiety and you have the tools to get through it. So exposure is basically going to school. So he wakes up in the morning, he feels really sick, but he goes to school, and he remembers one technique. He remembers a breathing technique that he learned that day. So he felt really sick, but he made it through the school day, and he goes home. The next day, the second exposure, it's like, I'm going to go. That second day, he goes to school. He still feels a bit sick, but he's kind of he has been practicing those techniques that he's been reading about, and he's using them preemptively. He's actually like utilizing them on the bus ride to school, and he's using them in between classes, and he just doesn't feel quite as bad. He still feels sick, but not quite as bad. And then each time he goes, like, those relaxation skills are becoming more natural. And now his anxiety about being at school, like, he can do it. It still doesn't, sometimes he like has those feelings and they're coming back, but he can do it. All right. So good job, you guys. Worked through it, and we figured out what's going on with this young man, and he's not missing school anymore. So now he's in school. He's able to participate in class. He's able to have his relationship with his friends, finish his grades, finish high school so he can go on to college and then go on to medical school. So we saved him so he can go on and be a pediatrician. So right on. Good job. All right. So that is what I have for my presentation today, you guys. But I want to answer any more questions. We have a few more minutes at the end here, so we'll talk about anything, okay? So I'm gonna go back to the top because there were a couple questions that I skipped. So what's a typical day in your work life? So for me, I work in an outpatient clinic. I see about 16 to 20 patients a day. It's been really different during the COVID pandemic. That has changed things. As you might imagine, we had to change how we did things to keep people safe. I now do telehealth visits, which I did not used to do. So I now will see people through the computer through Zoom visits, just like this. That was awesome because it meant that we didn't, for things that like anxiety, why come in and be potentially exposed to somebody who's coughing when I can talk to you at home? So I work 4 days a week is a full-time job for me. Thursdays I don't have clinic, which is why I get to join you today. But I do a lot of paperwork on Thursdays to kind of catch up with things. I also round at the hospital. So I do outpatient care where I see people from birth until 21 years old. At 21, I kick them out, unfortunately, because there are some things that a pediatrician should not be doing. So at that point, you get to transfer to an adult medicine doctor. And it's always sad to see them go. And they miss us because it's wonderful care that they get. So I also round at the hospitals on newborn babies. If there's a baby that's born at Tuality or Hillsborough Medical Center or the St. Vincent's Hospital, and they're going to be one of our patients, we will see them in the hospital within their first day of life and make sure that they're a healthy baby and talk to the families about what to expect when they go home and how to take care of that baby. And then I take phone calls. I take call. So overnight, if families have a problem, they can call us. So I got a call this morning at 6 a.m. from the hospital about a baby that was in the hospital and was helping the nurse kind of work through something. But overnight, if there's issues that and your child is sick, you need to talk to somebody so they can call us in the middle of the night. Yeah. So that's really different for different kinds of doctors. I'm not a surgeon, a surgeon's life is completely different from my life. So I'm not a hospitalist. I work in the hospital a little bit, but that's not where I'm mainly located. I don't do home visits. I wish I did. Some doctors do home visits. How cool would that be to go out and like, if a child or an adult has a really debilitating condition where they are bedbound or they have technology that's helping to keep them alive, like a respirator, sometimes doctors will go to see them in their house so they don't have to go through the travels of coming to their clinic. I don't do international medicine generally. Some people do. I have a great friend who has traveled all over the world to take care of people during Ebola outbreaks. He's been to Haiti twice after both the big bad earthquakes in the last decade. He's an emergency medicine doctor, and he travels to places who are in great need of emergency care. I have done some international medicine. I went to India for a month, and I traveled from mountaintop to mountaintop and set up day clinics, and that was like an amazing experience for me. But for the most part, that's not what I do. But there are so many different options and so many different things that you can do when you do medicine. Okay, I'm gonna go to the end now because there's some more questions. In total, how long did you spend getting your education? So for me, like I told you, I did an MD and a PhD. So if I count everything, so I started in kindergarten, I graduated from high school, I did 5 years of college, I did 4 years of medical school, I did 6 years of graduate degree program for PhD, I did 4 years of medical school, and I did 3 years of residency. So you can add that up for me, okay? And then you're always being educated. When you're a physician, your education is never done. There's always changes, there's always updates, there's always new information to learn. So you're a lifelong learner. You can't really look at it like I have 4 years of school and then I'm done. No, you're a lifelong learner. What technology or tools do you use in your occupation, and which ones are your favorite? So the mostly technology I use is a computer because I do my notes on a computer. So perhaps there's other physicians who use different kinds of technologies more so than me. I send patients for radiology images, but honestly, I probably don't have the most technology in my profession as some of my colleagues would have. Typical pay range for occupation, that's really variable. So no doctor is hurting. Okay. So again, even though medical school is expensive, no doctor is hurting. So at the high end of the pay range would be things like surgeons, cardiothoracic surgeons, orthopedic surgeons. At the lower end of the pay scale are going to be things like pediatricians and family medicine doctors, or some of the, so honestly, I would say during your training as a resident, you're a doctor, you finished your medical school, but your pay range is something like $60,000 to $80,000 a year while you're in training. And then once you've finished your education and you're not finish your education because you're a lifelong learner, but finish your residency and now you're going into practice for yourself, probably pay ranges anywhere from $150,000 to $750,000 a year, depending on what kind of doctor you are. Can you tell us about medical pathways that include the military service? I'm probably not the best person to do that because I didn't go through the military pathway, but I know that the military will pay for your school. If you want to do that pathway, that's amazing because they will pay for your school. Some of the very best surgeons out there came out through the military service. Yeah. Is it possible to job shadow with you? I absolutely do job shadows. I could do that through the different high school programs who do internship programs. I'm not sure what it's called, but I have had many high school students job shadow with me. So you can consider that an option. If you're going to do a job shadow experience, you can find me and ask if I'm available. That's fine. Why did I choose this career, and what are important skills for the job? So important skills for any job are to be on time, to be able to communicate yourself well. That wasn't a very good sentence, but you have to be able to communicate verbally, you have to be able to communicate in writing. You need to be efficient in your communication style. You need to be a friendly person. You need to treat people with respect. You need to understand that people around you, no matter who they are and what their experiences are, you have something to learn from them. So you need to be somebody who's open-minded. You need to be somebody who is willing to get into a situation that seems a little bit maybe like it's uncomfortable for you, like when you're a physician, you take care of people from all backgrounds, and you take a Hippocratic oath that says, I'm going to take care of everybody. I'm going to do no harm. And you have to be open-minded to somebody. If a parent walks in you might think, oh, this like Emily Pratt, she's just like this straight-laced person, and she has no tattoos on her face, but you know, maybe I take care of families who have tattoos on their face, and I don't know what's going on with them, and you just have to leave all your preconceptions at the door and be there for them, and be honest about things, and be transparent in your thought processes, and always remember that like you're a doctor, but you don't know everything. And that's true for anything. That's true whether you're a teacher. That's true whether you're a plumber, anything. Like these are qualities that are important for any job in life, is to know that you're a lifelong learner, be good at communicating what your skills are, know when to ask for help. So I could go on and on about that. How can you watch the recording session for today? You can ask your teacher about that. It'll be on YouTube, Kevin. Yes, you can have my contact information. So you can ask the teachers for my email. That's fine with me. So if you guys have more questions, feel free to reach out. And if you have, if you think we didn't take care of this student and you think we missed an ulcer, you let me know. Okay, we're a minute over. So I think that's it. Okay.
All right.
I hope you
Thank you
guys
so
enjoyed
much.
it, and good luck to everything. Okay.
Thank you, Dr. Pratt.
You're welcome. Bye-bye.